often used interchangeably, but are very different in what they offer. My name is Priscilla Barr. I am the host of the independent older adult. I am also the owner of Just Divine Home Care Agency. Today, I will explain the difference between home care and home health care. I'll explain what these services are and what they provide and how they differ. Home care providers are referred to by many names. They are called private duty home care, personal care agency, companion care agency, homemaker services, custodial care, non-skilled care, or supportive care. This type of in-home based care is also known as non-medical one-on-one direct care. It is provided by professional caregivers who are referred to as aides, caregivers, companions, certified nursing assistants, who are also known as CNAs, geriatric nursing assistants, home health aides, senior care aides, or carers. The caregiver or the aide provides valuable interaction with the senior. They provide light housekeeping, laundry, meal preparation, medication management, help with medication reminders. They help with errands, transportation, like picking up prescriptions from the pharmacy. They can drive you to the doctor's appointment. They can drive you to church. They can help with assistance with exercise, etc. Home care aides also help with assistance with keeping up with exercise, respite care for caregivers, personal care services, including bathing, toileting, oral care, feeding, dressing, and incontinent care. And home care is private and it's paid for with private funds. Sometimes long-term care insurance comes in handy. Home health care, on the other hand, is paid for by Medicare. It must be ordered by a physician, and one can only qualify for home health care when they are homebound. It has to be medically required. The home health care provider provides home health care provides medically necessary services such as wound care, infusion care, physical therapy, occupational therapy, social services, as well as speech therapy. Another difference is that home health care is only provided on a short-term basis. These services are usually between 45 minutes to an hour for a couple of days a week. It's only provided during a recovery period. It's usually prescribed, as I said before, it's usually prescribed by a physician after a hospital stay. On the other hand, home care, non-skilled care, is provided on a long-term basis and does not require a doctor's order. In home care, the aide provides support with activities of daily living, which is non-skilled services. Why will someone hire a home care agency or a private duty agency? An aging parent or a loved one may need companionship. They may need help with laundry, medication reminders, meal preparation. And usually this happens when you visit a loved one or you visit an Asian parent. You realize they haven't been eating right. They haven't been keeping up with their personal hygiene. And in most cases, it didn't used to be like that. But you can see a decline where you see a pile of bills that are unpaid. And you can see overwhelm where they are not able to keep up with their daily activities or their day-to-day activities. That is a sign that they need extra help. So maybe they haven't been eating right or they haven't been taking their medications consistently. Safety is usually a big concern. If someone is not safe to be left alone for several hours a day, it may be helpful to have a home care aide or a CNA or someone there who can provide that safety and companionship. Respite care is also a form of home care. So respite care is when a caregiver or a caregiver is hired to come in a few days a week so that the primary caregiver of the care recipient can take a break. Home care can also be used for just a few times a week to get your loved one or the care recipient out for a walk in the neighborhood, out for a walk in the mall, or to get some exercise or just some fresh air. So home care can be as little as 4 hours at a time, just a few days a week, or it can be as much as 24 hours a day, 7 days a week. So basically, home care is non-skilled care and home health care is skilled care. I hope this video helps you understand the difference between home care and home health care. Thank you for listening.